Okay, so dead bug is an okay exercise. I actually find that this exercise takes way too much coaching on our part. I feel like there's better exercises that we can use, bigger bang for your buck exercises. The reason why we're actually going to go over this exercise is because your clinic doc and clinic might ask you to do something that's kind of low key with patients. Maybe a doc that you end up in practice might want you to do this with a patient, but you'll tickle the fancy and do them. But you just know that there's other exercises that we can do that gets the job done a little bit more with less coaching. The reason why I don't really like this exercise too much is it's actually too difficult for the majority of our patients, because the big key here is being able to keep that rib cage stapled down to the pelvis, meaning approximated exhale, just like we did with supine 90-90 diaphragmatic respiration. That needs to stay there in order, and then move at the ball and socket joints. So dead bug position, get the ribs depressed. And I can start out by just doing heel taps here with the knees bent. And then I can make it more difficult by going full extension and through the hips. And this is typically when you'll see a faulty pattern here. Is when the patient goes to extend, they'll actually go into anterior and extend the hip. They'll lose the pressure in the abdomen. They'll lose stability through here, and they'll actually extend through the lumbar spine as they go into hip extension. So that would be that is a common fault there. Also, losing the rib position throughout the exercise is a common fault. From a tissue standpoint, you're moving one limb, and then you move contralateral limbs. So really, this is an anti-rotation exercise. So the tissues that you're going to be that would be kind of a goal is creating some anti-rotation stability. So the tissues you would be working, you're going to be working internal, external obliques, rectus abdominis as well. Depress the ribs. That's a common fault here. We go into arm flexion and extension. We lose that rib position here, and actually go through extension through the TL junction. Rep sets here, we're starting to get into core exercises. So my rep set scheme is going to be different. Keep it locked down as I extend the hip there. So rep set schemes for core exercises are going to be different than strength exercises, than facilitation exercises. They're going to be different. They may be different than facilitation. Depends on where we're at with in care. They're going to be different than patterning exercises for sure. So the big thing that I want you to keep in mind with core exercise, especially in the beginning of patient care, we're probably going to want to try and increase the patient's endurance in these certain patterns. And so the big thing with that is in order to create the endurance, we're going to have to do what's called we're going to go 80% RPE, meaning rate of perceived exertion, and you'll do 10-second reps. So we'll do 10-second reps until the patient hits their 80% RPE.